Back in with Rob in just a few minutes.
In the meantime, let's go ahead and listen in to the Madison County COVID briefing that's underway right now.
On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville Area Government, Healthcare, and our emergency response agencies, we bring you this weekly briefing on our community's response to COVID-19. Our speakers today will be Tracy Doty, Senior VP of Operations, Huntsville Hospital, and Mayor Tommy Battle from the City of Huntsville. You will note that we're sitting at least 6 feet apart according to CDC guidelines, as well as our own best practices to separate and sanitize. I'll begin with the current numbers. In the state of Alabama, currently there are 396,997 confirmed cases of COVID-19. In Madison County, there's 28,781 confirmed cases, having resulted in 375 confirmed deaths. We continue to monitor the situation and respond accordingly. Before we move to our first speaker, I would like to mention something non-COVID related. I just want to remind everyone that we are expecting significant severe weather in our community today. We just ask that everybody please be weather aware. As always, have multiple ways to receive weather alerts, and please make your plans now. Do not wait till the event happens to figure out what you're going to do. So with that said, we'll go to our first speaker, Tracy Doty from Huntsville Hospital.
Thank you, Jeff. I'm pleased to announce hospitals in North Alabama are doing well as it relates to COVID. We're seeing great numbers in our hospital systems and throughout the region. If you look at Madison County alone, we have 35 inpatients. 6 of those in the ICU and 3 of those on the ventilator. And last week reported out there's 39 in the hospital, so we still see a steady trendward down as we move forward. You look at the system, there's about another 25 inpatients in the system, 12 of those in the ICU and 7 of those on the ventilator. And at Crestwood, we have 8 inpatients there, 3 in the ICU and 2 on the ventilator. No hospital in our region has enough COVID patients to have a huge impact on operations, so hospitals thankfully are getting back to normal and doing the things that we do as far as procedures and x-rays and surgeries. So we're pleased to announce that we think vaccines are working, so we thank the partnership with the city and others with us using John Hunt Park as one of the vaccine locations. Talking about visitation, we get questions about visitation and what we're doing at the hospital system. You'll find our visitation policies on our website. There are no issues. Patients and families have been great to work with, and we'll continue to update those as the state updates visitation policies. We don't think we'll get back to the days of having tons of people in and out of the hospitals for various reasons. We've learned a lot over the last year, and looking at just ways that we can be safer, and the less people in and out, the better for everyone. We'll definitely let people come in when need be, and loved ones and visitors, but the days of having 15 or 20 of your friends coming in and out of the hospital, those days are probably over with across the country. But we'll continue to update those policies as things happen. If you look at masking, same thing. We plan to continue having masks in our hospital even after the state mandate goes away. We think masks are a big reason we are where we are today as far as the numbers going down. We think masks help stop the spread and keep you from getting COVID-19. So as we move forward, we plan to keep our mask mandate in place inside the hospital, but you'll see more as we get closer to that date in April. Talking about vaccines, going very well. John Hunt Park, we're there 5 days a week, and we have extended hours on Tuesday and Thursday. Today we close at 12 noon just because of the weather. So anybody that missed their appointment today can come anytime Thursday or Friday. No need to call, no need to do anything, just show up. We've got your vaccine ready for you, and the staff will be there to accommodate you. So anybody that missed their vaccine today, for any reason this morning, and we're closed this afternoon at 12, we're already closed. So come anytime Thursday or Friday, and we'll be glad to take care of you. We have vaccinated about 5,000 people this week. We get about 2,500 new doses, 2,500 second doses from the state, and we'll continue to do that as long as we're needed. We're glad to see other places are popping up across the city to have entry points for people to get vaccines. So far, we've done 103,000 vaccines across North Alabama in our system, and about 63,000 in Madison County. Again, we think this is a big part of why we're seeing our lower numbers as we move forward. If you look at just the disparities in health care when it comes to vaccines, there are many articles out there about disparities and people of color not wanting the vaccine, not having access to the vaccine. All sorts of different factors are out there. Early on, we started with strategic messaging, and you go back to our Facebook page, I don't know, a month and a half ago, and we had elected officials and local physicians do messaging about vaccines and the importance of getting the vaccine. Actually, today we partnered with the Huntsville Housing Authority and Tony McGinnis, and we're at Johnson Tower today doing their residents and some of their employees, and yesterday we're at the Tide. So between those 2 days, we've done about 175 vaccines of those folks who a lot of times can't get out or don't have access to a computer or just don't know how to fill the paperwork out. So we're going to continue to do that as we move forward. And also in the last couple of weeks, we've done about 6 churches in North Huntsville, partnered with those ministers to get their sick and shut in and some of their clergy members to be taken care of. And we have 4 more already signed up to take care of as well. So we'll continue to move across our city and our region, taking care of the pockets of people who don't have good access or computers or have some hesitancy. Another part of our plan was to make sure that we talk to people who are hesitant. So we've done a ton of Zoom calls with different local groups, fraternities, sororities, churches, motorcycle groups, whomever wants to talk to us. And we'll do those Zooms anytime they want. Just call the hospital, and myself or one of our other leaders will jump on the call, and we'll spend anywhere from 15 minutes to an hour to answer any questions and guide them along their way. We feel we're a community partner, and that's kind of part of what we do at Huntsville Hospital. We get tons of questions about vaccines and which one should I take, Moderna, Pfizer, or Johnson & Johnson. And our take on it is you should take whichever one you can get your hands on. So if you get the Johnson & Johnson vaccine, good, go take it. If you get Moderna or Pfizer, good, go take it. We feel that shopping around is not the right thing to do now. Vaccines are precious. I call them, it's almost like money or precious metal or something. If you get your hands on it, keep it, or go get it when you can. We get those questions quite a bit. And the last thing I'll kind of say is just if we look at our staffing and our employees, I want to give a shout out to our employees and healthcare workers across the state. Without them, we couldn't be where we are today. I know we have staff at our hospitals really stepped up, worked extra shifts, stayed around, taking care of patients, volunteering and going out to these different locations to get vaccines. So I can't say enough about our staff and the culture we've built in our system. Thank you.
Thank you, Tracy. And now we'll go to Mayor Tommy Battle from the City of Huntsville.
I'd like to piggyback on something Mr. Dowdy said. We want to thank all the healthcare officials that have been out there, that have been working with us for the past year. Many people don't realize it, but it was a year yesterday that we had our first case of COVID-19. Now you look at the numbers that have come through our area. Almost 30,000 people have had this had this virus, and this pandemic has affected people across the board. The vaccines are now working, and and we're very proud to see the success that is coming out of some of the vaccines. If you notice my attire today, it is a weather awareness day. We are encouraging everyone to stay weather aware. This weather system that is coming in has coming in 3 waves. One wave is probably already through. We have 2 more waves coming, and tonight, late tonight, is probably one of the most dangerous ones because most people are asleep and aren't staying as weather aware as they need to be. Be sure and try to stay weather aware all through the night so that you're ready in case you have to move to shelter. Have a plan in place so that you're ready to move forward. You know, as we talk about COVID-19 and the pandemic and our 1 year, this is our 1 year period where we finally hit it. A lot of people would look at our community and say that we have done very well through this, but we've done well because our community has bought in. It has been great partners, and we've had great partnerships. We've had great partnerships with Huntsville Hospital, with Crestwood Hospital, with the Alabama Department of Public Health, with all of our first responders, and our EMA office has done a wonderful job. That's how we've gotten to the place that we are today. We are starting to see a light at the end of the tunnel, and as we see that light, everybody wants to say that, hey, we're done, we're over with. We're not over with yet. We still have to stay masked. We still have to stay separated. We still have to stay sanitized at this point. You know, we have to get through this process as we go through it. If we do, we look this summer at being able to look at this in the rearview mirror and say, you know, it's time to get back to the new normal or get back to a somewhat normal condition. So we as a community are looking to try to get better, to get to that summertime look where we look in the rearview mirror at this and say, hey, we have made it through. It has not been easy. It's been a struggle. Everybody has done a great job in getting us through there. Everybody from our healthcare workers to our teachers in their schools, they have done wonderful work in making sure that we can, as a community, have come out and been successful getting through this pandemic. That's all I have. Thank you.
Thank you, Mayor Battle. And thank you for watching today. We'll be back here again next Wednesday, March 24th at noon for another weekly briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. As always, at this point, we'll take questions. As you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Brian Lawson, WHNT. For Mr. Dowdy, we've heard a lot from the administration about increasing shipments of vaccine and making that a priority. I wondered if you could describe the visibility you have as to volume of shipments. Do you have the sense that a lot more is coming into Madison County anytime soon, or what do you understand about the flow of would-be vaccine coming in?
Yes, sir. We work very closely with the state, and they work closely with the federal government with the vaccine supply. It's a supply versus demand issue now. We have more people coming online to give the vaccine, which made our volume go down, which is a good thing. We like to give as many vaccines out as we can, but as many places spread out across the state can give vaccines, the better people have access. So we think it's a good thing. In the next couple months, we think we'll have plenty more vaccines across the state, and we'll continue to be at John Hunt Park and other locations giving vaccines out.
Thank you. For the mayor, I was looking at my notes. Looks like July of last year, Madison County issued a mask order. Dr. Landers, as the health officer for Madison County, issued it. It was described as with the unanimous support of the mayors of Madison and Huntsville, also Chairman Strong and the health board. As we get to the point, this was before the state issued one, as we get to the point where the state's stepping away from that order, can you describe your thinking as to what's appropriate in terms of a regional order or a local order, or does that not make sense to you at this point?
No, I think that what we will be looking at is, again, doing just as we've done in the past. We will work with our healthcare partners. We'll work with Huntsville Hospital, with Crestwood Hospital, Alabama Department of Public Health, in making sure that we can follow through and that we do the right thing as we get there. as the state steps away from it, it may be time for us to step away from it. But we'll do it under consultation with our partners there, and that will be a decision that will probably be made right as we get close to that April timeframe where the state moves away from it. It all depends on supplies coming in, number of vaccinations coming in, number of cases that are cleared, number of cases that we have we have in the hospital at that point. And if our numbers continue to decline, it helps make the case that we have come through the worst of this. So there are still some decision points to be made, but it looks very good at this point, I would say.
Thank you.
Mine's for Mr. Tracy Doty. So,
If you don't mind, please identify yourself.
excuse me. My name is Grace Campbell. I'm with WAAY 31. So, you've been saying, when I've interviewed you in the past, you've been saying how there's plans to open up other facilities to give vaccines to the widespread area. Where is Huntsville Hospital standing with that right now, and what are some of the plans besides just doing some of the housing authority locations?
We think John Hunt Park will be kind of the fixed location, and we'll go out with our mobile medical unit and go to different locations across the city to get to those communities.
At this point, we'll end the press conference. Thank you for coming.
Thank you.
All right, so once again, that wraps up another Madison County COVID Response News Conference. Senior Vice President of Operations for Huntsville Hospitals, Tracy Doty, led things off with some good news. He says the number of COVID patients continues to trend down area-wide. He thinks vaccines are working and that using John Hunt Park Clinic, delivering those vaccines there, seems to be working. He reiterated that if you missed your vaccine today because, of course, the weather threat, just show up tomorrow or Friday, and you don't even have to call. Just go ahead and show up and get your vaccine. He also stressed that no matter what vaccine is available, if you are eligible, get vaccinated. And finally, he mentioned that they will continue the current mask mandate in Huntsville hospitals even after the state mask mandate expires April 9th. Marie, he wrapped it up with a salute to all the dedicated healthcare workers who have given so much of themselves a full year now into the pandemic.
Huntsville Mayor Tommy Battle picked it up from there, Pat. He echoed the thanks and appreciation for our local healthcare workers and medical facilities. As we reflect on the last year, he said our success is a direct reflection of the partnerships the county has with our medical and state leaders, and of course the community, all of us working together to fight the spread of COVID. In terms of what happens after the statewide mask mandate expires on April 9th, we heard Mayor Battle say a decision will be made closer to the date as far as whether or not they will continue the county mask mandate, and that decision will be made under the guidance of local and state health leaders, and all dependent, of course, on our vaccination and case numbers. Mayor Battle says this isn't over yet. He anticipates by the time this summer rolls around, though, that we will be able to put this in our rearview mirror and start to fully move forward once again. The next update is set for next Wednesday, March 24th at noon.